My name is Raven Cheney, and today I will be performing tasks of basic first aid in a small animal. First, I will be talking about fractures. Okay, so Rocky here has a broken right leg, and so we're going to be very gentle with him, and I'm going to place my muzzle on him. Be very gentle. And since he's so small, I don't need anyone to help me pick him up because he's so small. So I'm going to gently place him onto the blanket. You want to avoid touching his right leg. Now, I have him on a really thick blanket. Now I will gently lift him up and place him on the table. And now, while we're waiting on the doctor to come in, we want to stabilize this fracture until he can get in and perform surgery and put a splint in. So now, I will just gently wrap it, being very careful. So now I've stabilized the fracture, and now I'm just waiting on instructions from the veterinarian. Now, on my second part of basic first aid in a small animal, I'll be talking about bleeding. Now, this patient is bleeding, has a wound right here, and it's bleeding very badly. It's profusing. So, first, I'll place a thick gauze onto the wound. I'm going to hold it here with pressure. You want to hold it until 3 minutes, and then if you want to, then when you lift it up and it's still bleeding, you want to just apply a pressure bandage. Have to apply your muzzle. Now, if the bleeding is severe, you want to apply a tourniquet. And my tourniquet, I'll be using a stretchy gauze. And you want to loosen the tourniquet every 20 seconds for every 15 to 20 minutes. I will now be continuing where I left off, and I will now be talking about a chemical burn versus a severe burn. First, I will muzzle the patient. He's now muzzled. He has a severe chemical burn. I have my gloves on, so I won't get the chemicals on me as well. So now, I will take him over here to the sink. And you just want to run cool water over the chemical burn. You want to make sure you get all the chemicals off the area. When we've rinsed the chemicals off the area, the veterinarian will come in and take further. We'll be sure to come in and treat the chemical burn. You just want to kind of dry it off a little bit. And then we'll be waiting on further instructions from the veterinarian. I will now be talking about a severe burn. I did the chemical burn, and with a severe burn, you want to first place a muzzle on. And then you want to apply a cool compress to where the severe burn is. And then once you apply that, you want to take it off. And as the patient is cooled down, so we will be taking further instructions from the veterinarian. I will now be continuing where I left off on my basic first aid in a small animal, and I'll be talking about choking. As you can see, that the patient is having a difficult time breathing. He's pawing at his mouth. I mean, something is lodged in there. So you want to be careful when you're dealing with an animal that's choking because they will more than likely bite. So you want to look at the gums, and they are pretty blue. And you want to see if you can get the object out of his mouth. And if you can't get the object out, you want to perform the Heimlich maneuver. So now I'm gonna take this animal, and you want to go between where his rib cage ends. You want to just press like. And if you want to create a big gust of wind so that it'll propel whatever object is lodged inside of the animal's throat. And then if the object comes out, you want to make sure that the vitals are good. And then we will take over, and then the veterinarian will take over from there. I will be continuing where I left off on my basic first aid for a small animal, and we'll be talking about heat stroke. When an animal comes in and has a heat stroke, you want to be sure to check the temperature. And the temperature will be more than 102. So we will say that his temperature is 103, well 105 rather, because it's pretty high. So you want to place a cold rag around the animal's neck. You don't want to place it over their face. That might scare them and cause them to flail everywhere. And you can do this on the extremities, you can do it on the tail, you can do it on the abdomen, but not on the face. You can remove the towel and wring it out and re-wet it as needed. And say if it dries out, you can go re-wet it as well. Now, when the patient is cooled off enough, which the temperature should be back to normal, which would be between 99 to 102. So once the animal's cooled off, you want to be sure to let the veterinarian know that patient has cooled off, and then the veterinarian will take over from there. I will now be talking about shock in my basic first aid in a small animal. As you can see, I will check the gums. That's when the animal is in shock. You want to check the gums to make sure if they're not the pretty pink they should be or the bright pink they should be, then that's a serious problem. The animal is definitely in shock. So I'm going to check the gums, and they're quite pale. And you want to check the capillary refill time, which is less than 2 seconds. So I will digitally blanch the mucous membranes. And it took 4 seconds for them to turn back to their normal color. So now I want to check the femoral artery or pulse. And that pulse is barely even there, so it's quite weak. So now I'm going to escalate the heart and lungs. And while I'm doing this, I will get a respiratory rate and a heart rate. And with things like that, the doctor will be getting meds ready for the patient, and he'll be giving us further instructions. And you want to be sure that you be quiet, be calm, because you will really freak the animal out, and you want to make sure that they're comfortable where they are. And in case if the animal is unconscious, you want to make sure that his head isn't all the way over here. You want to be level with the rest of the body, and then we will transport the animal to the veterinarian. I will now be continuing where I left off on my basic first aid for a small animal. And I'll be talking about seizures. As you can see, the animal is seizuring, and you want to be quiet and calm and make sure that there isn't any other objects that the animal can hit. As you can see, there's no objects that the animal can hit. And I will time the seizures. They usually last for about 2 to 3 minutes. After that, if it lasts longer, then you really want to get the veterinarian involved quickly. But once the seizure stops, you want to transport the animal to the veterinarian, and then he will take further control of that. My name is Raven Chain, and I'll be continuing where I left off on my basic first aid on a small animal. And so I'll be talking about toxins and poisons. And now I'll be on the phone with the client that we have here. Hello, Miss Nixon. What seems to be the problem? Your dog ingested grapes. How do you know that your dog ingested some grapes? You left the bag on the counter. Okay. Is there any symptoms? Is she vomiting? Does she have any diarrhea? Is she lethargic? So she's been vomiting, she has diarrhea, and she's lethargic. Okay. Can you hold for me, please? And at this point, I will be consulting and talking with the doctor to ask what we should do in a case like this, since the animal had ingested some grapes, and now I'm going to get the since I know this client, I know that it's a dog and it weighs about 5 pounds, 6 pounds around there, and I know its age, I know its weight, so I have all the information already on the chart. Hello, Miss Nixon. Okay, I've talked with the doctor, and the doctor said that you need to bring Daisy in as quickly as possible as you can, and we will immediately start to work on her. Okay, I have all your information right here on the chart, and we'll be waiting for you. Okay, thank you. So now that I have talked with the client and I've told her what she needs to come up here immediately. We will be getting things ready, prepared for the patient, since the patient ingested some grapes. That is how I would take care of a toxin injection. I will be continuing where I left off on my basic first aid in a small animal, and I will be talking about an animal that has ingested a chemical or poison. So I'm on the phone with Mrs. Wright. Hello, Mrs. Wright. What seems to be the problem? And again, she's not a client here, so I'll be instructing her to call this number after I get all of her information. So what happened? What did she ingest? So you think that she ingested some bleach? Okay, how do you think that she ingested that? Did she chew up the container that it was in, or did you see her start looking at it and the container was open? Okay, so the container was open and she knocked it down and she started drinking it. Okay, Ms. Wright, what kind of dog is it? It's a Cocker Spaniel. How much does it weigh? 30 pounds. And what's the dog's name? DB. Okay, how old is the dog? 2 years. Okay. Well, Ms. Wright, unfortunately, we don't deal with chemical ingestions or poison ingestions, but I will give you a number. They're 24 hours a day, 365 days a year. And that number, are you ready for that number? Okay. The number is 888-426-4635. Okay, because they will be able to help you with the chemical injection. Okay? All right. Have a good day. And that is how you would handle a poison injection.